Northern Ireland.
Sammy Wilson, many thanks.
The time is 9 minutes to 9. Bed blocking is a horrible term. It's not as if most people want to stay in a hospital bed if they don't need to be treated there. The problem is there's so often nowhere else for them to go, and an analysis carried out by the Liberal Democrats says that it is worse for people with mental health or learning disabilities. People like Oliver Lang, who's 27 and has Asperger's and anxiety disorder. He was in hospital for 4 months longer than he needed to be.
I felt like I was in danger in there because a lot happens in hospital, and I felt like if someone attacked me I'd have to defend myself, but if I did defend myself and hurt someone then they'd say I was a danger to the public still, so they'd keep me locked up for longer. So I was trying to be whiter than white. I was trying my best to keep my nose clean and that, but it was hard because you felt like you were having to defend yourself. Even the staff used to say, they used to call it a prison with perks, because there was no treatment happening. If they thought I was mentally ill and that's why they locked me up, why weren't they giving me any treatment? They were wasting money keeping me locked up. At the end of the day, it all comes from the NHS pot, but they were only thinking about they say I've got Asperger's and I've got black and white thinking, but they have black and white thinking because they only think about their little pot of money and whether it comes out of their little pot of money, do you know what I mean? But the fact is, I'd rather be in prison because at least you've got a release date, at least you know when you're getting out. Hospital, they can lock you up and throw with a key, and you can be locked up there as long as they like, basically.
Well, Sean Duggan, Chief Executive for the Mental Health Network of the NHS Confederation, is in our Westminster studio. Good morning.
Good morning.
The relevant figures are that delayed discharges has been a 30% increase for physical health care and a 56% increase for mental health and learning disabilities patients. Were you aware of a gap of that sort?
Yes, we are familiar with the delayed discharges from mental health inpatient units into the community. I mean, that is a very, very high figure, and we've got to do something about it very quickly, because as the person just said just now, that if you don't, then you put a lot of pressure on the system, and it's very expensive. It's much better to have an efficient system where people get discharged into the community, and then people that need care, intensive care, can have that.
Well, not just pressure on the system, the impact on the patient as well, because when you're hearing that description from Oliver Lang, someone who has anxiety difficulties, and they're in hospital having no treatment for 4 months longer than they need to be, at the point that they are eventually discharged, they could have deteriorated significantly in that period.
It's very unfortunate for Oliver, and as I said earlier, there are also other cases, and you talked about the percentage. It's complicated. There isn't just one particular issue. I mean, one of the main things is that we know that 49% of people that are not being able to be discharged is because they don't have suitable accommodation, and that can be supportive accommodation, which is ordinary accommodation, or accommodation whereby you need some social and health care. And in some cases, we are talking about people with very complex needs. An intensive package of care needs to be put in place, and that takes a bit of time to get organised, but not 4 months. It has to be done a bit quicker than that. But it also relates to what's been coming up in your programme all morning, and that's social care. There is a real pressure on social care, and I think we're getting to tipping point at the moment, because for people to be discharged from hospital don't need treatment. They need a variety of social care and housing to be available to them, and that isn't always available across the country. There's some very good examples, but it's not always available across the country, and then that of course puts pressure back onto the system.
Yes, and the Department of Health says there's £400 million over 4 years going into making sure mental health teams provide more intensive support to people in their homes. Now, that doesn't sound to me like it's going to tackle something like housing and supported housing, which you've identified as one of the problems here.
Yes, we now know that you really can't consider mental health in isolation. It is part of a system with social care, housing, and if you take children, it's education and teachers. So you really have to look at the broader aspect. Now that's money, we know about that. That's in healthcare. Now that will be very helpful indeed, and it will provide some benefit, but it's not going to be the answer. It's only one part of the solution, and the other parts are social care and housing.
Sean Duggan, thank you very much.
3 minutes to 9. Scientists say an iceberg is about to break away from Antarctica. A big one.